We will explain about anaphylaxis. Hypersensitivity is defined as exaggerated or inappropriate response of immune system. In most cases, harmless antigens are targeted and this results in tissue damage. Hypersensitivity includes allergies and autoimmune diseases and can be classified into 4 types, 1 to 4. We will explain about anaphylaxis in type 1 hypersensitivity. Type 1 is immediate reaction.
Next, I will explain the mechanism of anaphylaxis. First, when an antigen enters the body, plasma cells produce specific IgE that can bind only to that antigen. Second, this IgE binds to mast cells. Mast cells have high affinity receptors for IgE, Fc receptors. IgE bind to these receptors. Third, the antigen binds to IgE. Here, when an antigen binds to 2 IgEs, a structure that bridges 2 Fc receptors is created. This phenomenon is called cross-linking of receptors. Cross-linking activates mast cells. Finally, from activated mast cells, inflammatory mediators such as histamine inside granules are released through a process called the degranulation response. Also, from activated mast cells, lipid mediators such as arachidonic acid metabolites are released. The main actions of these mediators are vasodilation, increased vascular wall permeability, and smooth muscle contraction. As a result, those mediators cause an immediate allergic reaction within minutes to tens of minutes. This is called anaphylaxis.
Now let's see the symptoms of anaphylaxis. Take a look at this. These are all symptoms of anaphylaxis. In these symptoms, the most common are skin symptoms. Hives is caused by vascular permeability promoting. Respiratory symptoms are caused by contraction of bronchial smooth muscle. The dilation of blood vessels can cause a sudden drop in blood pressure and loss of consciousness. This is called anaphylactic shock. This is very dangerous and can result in death if not treated as soon as possible. Especially bee venom and drugs can be serious. For treatment, antihistamine and inhalation of bronchodilators are effective. If symptoms are severe and rapidly worsening, intramuscular injections of adrenaline are given top priority.
Adrenaline first suppresses the release of histamine. In addition, it normally binds to alpha-1 receptors to constrict blood vessels. It decreases vascular wall permeability. On the other hand, it dilates smooth muscle and prevents bronchoconstriction.